Yeah, I think my involvement in the study of relapsed TLL is more clinical, early phase clinical studies. I chair a early phase clinical trial that we run through the European Paediatric ITCC network and in adult centers in the UK, which is targeting the RAS pathway in TLL. And we know that RAS signaling plays a role in TLL. We know that if you inhibit RAS pathway, that you can sensitize certain subtypes of TLL for dexamethasone. And we also know that if patients with TLL relapse and they have RAS pathway mutations, that they have a very, very poor prognosis. So one of the clinical questions we are asking is whether if you inhibit the RAS pathway in patients who have mutations in this pathway and combine this with dexamethasone, do we see a response signal which would then help us to take this drug forward in more frontline treatment of TLL? Well, preclinical data, yes, but not clinical data. We are running the trial, and we've only recruited 3 adult patients so far. You can look at the website. It's a Zelodex trial, it is, and you can also go to the ITCC homepage and find out more information about the trial. It's run through our European Phase 1 network. And it's open at the moment. It's opening in France. It's opening in the Netherlands. It is open in the UK. We are in discussion with Germany, and it is opening also in Scandinavia and probably also in Italy. Well, I think one of the most promising drugs at the moment, where the most pediatric oncologists are enthusiastic about and want to test, is anti-CD38 antibodies, and they are in trial at the moment. There are individual patients who have had fantastic responses, but I think we need to see the data to really get a clear idea what role this drug will play in the treatment of TLL or TLL relapse. Well, this trial which we run for the RAS pathway, this is open for children also, but there are not many patients, fortunately, that qualify, so it will just take a little bit of time to recruit. Also, the trials with the anti-CD38 antibody daratumumab are open and recruiting in several European countries. Well, in the frontline situation, we have standard of care. In the relapse situation, it is very difficult because the relapses in TLL seem to be very treatment resistant, and so I think there is room to test novel drugs. We know that drugs like nelarabine and we also bortezomib have phase 2 data that suggests that they are effective, but how do we best incorporate them in the treatment of relapse therapy is what we need to find out. Well, that's what we're all working with our clinical trials units to develop more creative statistical methods that help us to faster get an answer.